The front of the mask is dirty. For removal, handle only the ear loops, ties, or elastic straps. Remove the mask from your face by bending forward and pulling the mask forward in a downward direction, allowing it to fall away from the face, then discard. To complete the process, perform hand hygiene one more time. Remember to perform hand hygiene anytime you suspect your hands are contaminated during removal of protective equipment. Let's review all of the steps for putting on and taking off personal protective equipment. First, perform hand hygiene. Put on your personal protective equipment in the following order: gown, mask, eyewear, and gloves. Remove your personal protective equipment in the following order: gloves, gown, eyewear, and mask, remembering not to touch contaminated surfaces. Perform hand hygiene after removing gloves and gown, and again after taking off eyewear and mask.
We do fit testing yearly, right? And is that all caught up, or do you still have people to fit test?
We're mostly caught up. We've got a few maybe, but not many.
Okay. I know during that period where the new CAT scan was being done, and when Judy's office was in here, I know that it went by for some time during that period of time, because it was so cramped and to find the stuff to do it, to have the time to do it. But since everything's back, Brett and Judy are back to fit testing. So if there's somebody that hasn't been, get a hold of them. Quality improvement, we had no hospital-acquired infections in 2015. There were 256 inpatient cases reviewed and 231 cultures followed. Antibiotic usage, 100% compliance. Now what that means is, like, anybody that is admitted as an inpatient, I follow ERs, I follow outpatients. If they come to the hospital from a provider to have like a shot of antibiotics or IV antibiotics or whatever, and they've had a culture done, all those patients I follow from the time of the culture to the final culture report. And there's a form that I fill out and as to what antibiotics that they have been taking. And so at the end of the culture, the final report goes to the providers to make sure that they are on the correct antibiotic. Also, like if they've been discharged, they're still, and there's times when the patient that has gone home on a med, when the final culture report comes in, they do have to be changed. So we're trying to keep people healthy and be on the right antibiotic instead of a whole course of an antibiotic that isn't right, and then they end up coming back because they didn't get better. Hand hygiene for the year, the total compliance rate was 91.5%. So thank you, everyone. Another report that we do is the ILI, and that has to do when flu season starts, like CDC, how they track the flu in all the states. There's a form that I fill out, and I think that lab does this also, only different, as to flu cases and the number of patients that we had that week. I email it to the Southwest Public Health every Monday for the previous week, and then they send it on to the CDC. So we do that. Needle sticks, we had 3 last year. Testing was done and education was provided where needed. Tammy is still the employee health person, and so she takes care of needle sticks. In response to the needle stick, immediately allow the wound to bleed freely. Wash the exposed area with soap and water. Report the incident to your supervisor and Sandy, who will contact a provider if applicable. Immediately fill out one of the incident reports, and it is in the mail room. And a drug and an alcohol screen will be done. If the injury occurs after hours, then you need to call Lab In, and they will know what they need to do. Sandy will contact Tammy Cothra, and she will get a hold of you as to what the next step or the details are. The other big thing right now, which it's going to be, is antibiotic stewardship. Has everyone heard of antibiotic stewardship? It's kind of like the environment. We've almost used the environment up and the earth up, and so now they're all getting excited because we're using and destroying the ozone layer and the icebergs are melting and all that. Well, we've come to a spot in the United States and the world that our antibiotics are running out and the bugs are getting smarter. The bugs are genetically altering, and so that the antibiotics that used to kill them aren't killing them anymore. So we have to reset and redo our way of antibiotics. Resistance wasn't a problem in the 60s, 70s, and 80s because there were all these new antibiotics out. And so if you were put on one antibiotic for something and it didn't work, they had more to pull off the shelf and give you. Well, now the bacteria are becoming resistant, and we've had no new antibiotics for like 30 years. The chemistry of the way that they're made has not changed for like 30 years. And so we're getting antibiotic resistant. There's a TB strain right now in 100 other countries that is not resistant to that is resistant to everything. There is no cure for it or getting better from it. Also in the United States, what is common, like common bugs, like a lot of the UTIs you used to see Klebsiella pneumonia. Well, or E. coli, or whatever. Well, now we've got Klebsiella pneumonia, and we've got strains of E. coli that are present in the urine for a UTI that are antibiotic resistant and becoming resistant. So it's very serious. Not only just from human aspects, like they're putting antibiotics in animal food, like your big cattle operations, your chicken farms, their food that they're feeding the animals, the beef, the pigs, the poultry, they're getting antibiotics as a way to keep the animals just prophylactically from getting any diseases. They don't just take, like, you've got a herd of cows and they take one cow out because it got sick and they nurse that cow. Now they're prophylactically treating the whole herd so the whole herd doesn't get sick to begin with. So that's dumping a lot of antibiotics towards prophylaxis, which is in turn getting more superbugs also. So the government is looking into that as a way of taking different measures and to start buckling down on that type of thing. Things that we can do is take antibiotics exactly as your provider tells you to. Only take antibiotics that have been prescribed to you. Don't call mom up and say, do you have any antibiotics left from when you had this cough because now I got it? Don't save antibiotics for the next illness or share with others. Don't come to the clinic because you have a cough and pressure your provider into giving you an antibiotic, and people do get mad. They'll come to the clinic because they aren't feeling well, because they have a cough, maybe they have a temperature. Well, it could be a virus, not necessarily they have like something that gets treated. They don't have a bug, a virus. Antibiotics aren't gonna help. And I've heard patients in the clinic get angry before because it's like, I took a day off of work and I'm coming in here and I spent money for the office call and I feel like crap and I want to feel better and so I want an antibiotic. Well, we need to educate people that antibiotics only work if you have bacteria or an infection. They aren't going to work on a virus. Most important is the hand washing. Hand washing is the best thing to help the spread, stop the spread of germs and diseases. Anything else? Any questions? Like I said, thank you everyone, because I think you do a great job. And you really try hard. any suggestions, if you ever have any suggestions that you saw, like maybe you're coming up with something in your department that you need something done differently, please come and tell me. I welcome any new stuff. Okay. Well, thank you.
Thank you.
Yes.
Vince leave?
No.
There it is.
There's, I'll cover it.
Is that floor a little hard?
A little bit.
I wonder how you're doing.
She's young.
Yeah,
I
we
thought
got it.
about that, actually.
Yeah.
You didn't eat very much.
You went right to the trap. Ready for you?
The same one that was
Yeah.
in nursing Sunday.
I don't know, he was making his rounds today. Doing a complete circle.
Okay, I got a couple I'm gonna go over. The first one is the tornado policy. We need to go over that every year, so we're just gonna do it right now. Does everybody know what a tornado watch is?
Conditions are favorable.
Conditions are favorable and a tornado can happen at any time. So once a watch is issued, what we do here is the ward clerk or whoever's at the desk out there, they are going to pull a form that we have there. It's our sign sheet for our tornadoes. Everybody that's in the building, each department's gonna get a phone call. You need to come sign in on that sheet when the tornado watch is issued. In turn, if it's a long-term watch and your shift ends and you leave, you need to remember to sign out. As each department is emptied out, the last person in the department, make sure when you sign out, you tell them everybody in your department's gone. That way if somebody just didn't get signed out, they know at least that they're gone. At the point that we have a tornado watch, people will go around, all the doors that we're not using, we'll close those. That way we don't have to do it later. All blinds, room doors, equipment not being utilized, put up, closed up. And at that time, Dietary will bring out a tornado cart for water and stuff like that to the nurse's station. If it escalates to a tornado warning, then that means that it's imminent or one's been spotted by a trained weather spotter or radar. At that point, the administrator will be notified, the DON will be notified, and the charge nurse and the facility will be notified through a page overhead that it's been turned over to a tornado warning. The overhead announcement will be announced. Like I said, all staff will report to the nurse's station. Our safe area is between the fire doors down this hall, these fire doors, the ones by the dietary, and these right out here. We stay inside that area for our tornadoes. Once you get to the nurse's station, the charge nurse will give instructions to employees of what needs to be done, and all staff is to help with evacuation of patients because it will bring them up here also. Clinic patients, hospital patients, they all come here. Like I said, our safe area is between these fire doors. We can also go into dietary, or not dietary, but the dining room. If we have a large number of people, we can spill into tech corridor and also in the conference room here.
And OR can be used, but as a last resort. So.
And the way the hospital gets notified is the sheriff's office calls up here. There's a tornado watch issued. They'll call up here, tell them. Usually you're gonna hear them page the ambulance and fire first on the radio out here. Because what they do is the National Weather Service sends that out over TV. If you're watching TV, you're gonna see it way before they call you. But then they'll page first responders, and then they call Hester home here and let everybody know what's going on. The one thing to remember is, even at night, if you got one patient and there's just a couple of you, these policies are still in effect. If there's a warning, you need to be getting everybody to the safe area, get the doors closed.
My comment on that, though, a patient has the right to refuse to come out of their room, because we've had that in the past. We've had a patient that didn't want to come out, and there was a little to-do about a nurse happened to stay in there, and apparently a nurse doesn't stay in there. They're notified that you're going to be left alone. There's not going to be a nurse in this area, and then you leave the patient by himself.
Right. Which, hopefully that doesn't happen very often. If we have people in the reception area, we try to get them to come in here. We can't make them, same thing there. If they want to leave, there's not a whole lot we can do about it. We just try to inform them of the risks if they do. They still have their rights. So. Any questions on any
Hey,
the tornado?
that's RT.
Okay, I'll go into the fire drills.
159.
For those of you that haven't ever seen it, or new or whatever, this is what we use for our fire drills. Basically, if we're having a fire drill, that's what you're looking for, is that flashing red light.
I can see.
You're short, you know.
I know.
Maybe in the front row.
I should have been up there.
We'll touch on the safe magnets. All of our door frames have safe magnets. We try to keep them in this area right here. That way the shorter people can And what you want to do is, if that door happens to be close to that room and that safe magnet's still up here, you want to feel it with the back of your hand. Make sure there's no heat on it. Move down towards the doorknob, make sure there's no heat. At that point, you could open the door, check the room, make sure it's safe. Close the door. You want to move that safe magnet down even with the doorknob. That tells everybody that comes behind you, including the fire department, that room's been checked and it's safe. Once the drill is over, everybody's supposed to come to the nurse's station and we'll do a debriefing and go over what went well. We need to work on anything, we'll go over that at that time. The one thing to remember is everyone that's here is actively supposed to engage in the fire drill. So if you don't come to the debriefing, don't tell somebody to sign your name, because it's got to be signed in your own handwriting. Nobody can sign for you. So that's kind of the way that works. Fire doors, we've had some questions in the past whether you can go through a fire door. Once you've checked your area and your area is safe, it's the same as a regular door. If you feel it, there's no heat, look through the window. If you can't see smoke or flame, you can cross that fire door and you can go on into the next compartment and help look for a fire. Downstairs, when we're having a fire drill, if it happens to be downstairs or you're looking downstairs, right at the bottom of the stairs, it's going to be about this level right here on the wall right at the end of the stairs. It's labeled emergency boiler shutdown switch. Before you open the door to go into the boiler room, you want to open that. It's got a little cover on it and just flip that switch down. That kills all the gas, everything to that boiler room that could be combustible. So when you open that door, you're not adding oxygen to gas and making a bigger fire. So, and don't worry about turning that back on. We'll turn it back on and we'll make sure everything comes back up, because it kills everything, pumps, gas, everything. So, elevator can't be used during a fire or a fire drill. So don't want to get on that. The person that runs the fire panel, once you go to that